the opportunity given to me by Amity University as well.
Pleasure is all ours. And the context of this conversation is Amity Institute of Training and Development looks at supporting individuals, team managers, as well as people leaders in meeting their productivity challenge. So we are talking about productivity. Nothing has impacted productivity so much in the last few months as COVID has. Sumeet, we are looking at 26 to 27 million cases across the world, more than or nearly 900,000 deaths, which is a huge tragedy. And in India, we are facing our own onslaught of cases with a large number of active cases as well. What's your reading on these, huge numbers? Has the healthcare industry risen to the challenge? What do you think?
So, Nitin, just talking about numbers, we'll start with India. Out of the 26 million or so cases which are globally there, today India is at about 4 million. It's about to touch 4 million as of today. It will be number two as a nation in the list of countries which are impacted by this pandemic. And if you look, I think, just to answer that question, that India has definitely risen to the challenge of COVID-19. If you look at our front-line workers, whether it be the doctors, whether it be nurses, paramedic staff, they've all put in their best effort to contain this pandemic. If you look from a policy standpoint, the government has also very quickly realized that this would spread, and bought some time early on by having and imposing the first lockdown, and then followed by 2 or 3 more lockdowns, which happened. So. And I also want to recognize here that a lot has been done by not only the healthcare community, but if you look at the policymakers, which is the government, if you look at the supply chain, which is there, when it comes to delivering healthcare, it's important to have a good supply chain and have the ability to mobilize stuff, which includes ventilators and hospital equipment and medical furniture, and even personnel. So India has done a fantastic job. Now, if you look at just the numbers, we're talking about 4 million cases in India, and the number of deaths are standing at about 65,000 as of today. So if you look at the death rate or mortality rate from COVID-19 stands at about 1.77%, which is actually half of what it is at a global level. So if you see globally, the mortality rate would be over 3%. So again, that just showcases that India has really risen up to the challenge. And if you look at the way we have ramped up, there are a couple of things that has happened. If you see, there was only one lab which was accredited by ICMR to take on COVID testing when we had our first lockdown. And today, there are over 70 labs in the country which are able to conduct those tests. Then when we look at PPE equipment, I remember, Prime Minister Modi touched upon it as well from the Red Fort on 15th August, that PPE equipment in every area, if you think about it, from gloves to masks to, just gowns, we have so many factories that are able to produce it. And when we started with the pandemic or the onslaught of it, we had very little access to PPE. So from that perspective, again, India has done fantastic, and so has the ancillary industries which support healthcare. Nitin, I think you're on mute.
Thanks for that, Sumeet. So if I was to dive in, can you hear me okay now?
Yes.
If I was to dive in on what's going well, you talked about innovation, you talked about the front line and the healthcare services, the whole healthcare services setup stepping up to the challenge. Are those the two things that you would recognize as going well, or is there a third?
So I think the other part of it is, the mobilization of resources was quick. So whether it be healthcare or otherwise, it happened very quickly. And I think people during the first lockdown obviously were very much supportive of the policy around it. And then eventually, obviously, things wear out. And I think a lot of people are now understanding that there is a good reason why one should wear masks when in public and try to avoid social contact and maintain social distancing. So I think that has also helped quite a bit. Is the awareness of this disease, because if you think today, the digitization that has happened in India has allowed for people to really embrace this change of behavior. And I think behavioral change is very important in any kind of healthcare delivery to be successful. And I think by having the channels of technology, we were able to spread the message faster. And I think compliance by people has helped. And I think the other part one should be aware of is that we just don't want people to be more callous around it. The prevention is the best cure, as we hear, and I think that is something which we need to follow up on. And I think a lot of people, including celebrities, have come and done a lot to kind of build that awareness. The government has also very quickly launched the Arogya Setu app, which allows for contact tracing. And I think, just recently, Google and Apple have also just announced this week that contact tracing would be something they will do together as technology companies. So I think there is that technology element which has also played a big role in preventing the spread and really rising up to the challenge.
And as we were starting this conversation, waiting for this conversation to start, we asked a poll question. So I'll share the responses with you. I think those responses are visible to me. Do you think India's healthcare system has risen to the challenge? 30 majority of us actually said yes, and some people said no. So for the cynics amongst us, what could have been done better? What's not gone that well as it should?
See, I think that when you think of the pandemic and specifically COVID here, there was no playbook. There is, everyone around the world was taken by surprise. Yes, there were some early indication from China that there is a disease of this sort, but everyone again thought that it's like Ebola or SARS or something on those lines, which allows for you to see that eradicated very quickly or contained in that region. But epidemiologists very quickly realized that this is something which is not going to be contained with the travel and movement. And I think if we look at it today, even the WHO declared it as only as a pandemic in late February, right? So again, many governments were grappling with the situation, and if you look at it with no playbook in hand, right, you really have to do a dipstick approach in terms of responding. And you can be, and many times, the cynics amongst us will think that, we were very reactive. Yes, we have to be reactive at times because without a playbook, you will be reactive. And if you had a playbook, you could be responsive, right, to something like this. So, but if you just look at the pure statistics, let me indulge you in some numbers out here. The number of people who die in India is around about 11 million people die in India annually. And in that, 60% die of what they call NCDs or non-communicable diseases, and about 40% are communicable disease deaths, right? And if you look at that, about 3.7 million, about 30%, 35% of the people who are dying of cardiac diseases. About, I would say, 1 million are dying of cancer. Then about 200,000 are going to be dying because of liver-related ailments. Another 1.5 lakhs or about 0.15 million will die of road accidents. So if you look at COVID, and you look at over the last 8 months since COVID has been prevalent in India, we have only had about 65,000 deaths, right? I mean, so if you put that in perspective, in the larger perspective, the number of COVID deaths is minimal, right? And what I fear is that we will have we are spending disproportionate amount of resources of the healthcare towards COVID and its containment. And my fear is that we, in this 7 months, have not been able to provide the care, the much needed care that was required for the seriously ill in the other categories, right? And they have not been able to access hospitals at times. They have not been able to get the care that is required on a continual basis. So I think that is where we see a disproportionate amount going and more attention going to COVID, and the stigma around it is creating that. But I think that's where healthcare has to do the next phase of responding to this challenge. Will require us to actually look at the sick who have been ignored during these 6 months.
Right. So the point, let me ask you the question slightly differently based on the statistic that you just shared, which is interesting. Do you think we should not be worrying about COVID and going about business as usual because we have bigger diseases to worry about? Or is this a wake-up call for us to learn something from COVID and do something for those bigger challenges, those bigger life-threatening diseases that have been troubling us and holding our country back? Which perspective are you taking here?
So, Nitin, I believe that this pandemic and COVID-19 is a wake-up call for the healthcare industry and globally, and also in India. I also think that we cannot ignore it. I think what I was just by stating the numbers, I was just saying that it's minuscule as compared to the disease burden in India, right? So if you think about it, again, let me again indulge you in some numbers here. But we are 17% of the world's population, and we have 20% of the disease burden in India sitting out here. So it's disproportionate, anyways, to start with. And now, if you think about it, our spend on in the global healthcare, which is about $12 trillion, we are spending somewhere over $100 billion in healthcare annually. And if you think it's only 0.8% of global healthcare spend, with 20% of the disease burden and 17% of the world population. Now, even if I was to adjust that with PPP, purchasing power parity, because we are talking about US dollars, even then it will remain minuscule. And I think that's what we need to fix. So if we come to where the problem is, I think it's a wake-up call to say that, are we spending enough on healthcare? Is it an area which needs to come into focus? And has the spend been adequate over the years? I definitely think not. So we really need to look at this in a more focused approach and really think of a pathway of how to get into even universal coverage, which we are talking about, right? How do we do that? Without funding, we are not going to go anywhere.
I'm with you. So we're going to run this as a panel. I'll invite Brigadier Sharma, my colleague, to step in at this moment.
Thank you very much, Sumeet. Nitin. Mr. Sumeet, you mentioned in the answer to the last question in passing about many important surgeries, elective surgeries and other activities could not take place. Now, this has resulted in a financial distress for the healthcare sector. Now, what do you think is the kind of impact, financial distress the healthcare sector has gone through, and what can be done to support healthcare sector now at this time?
So very good question, Brigadier Sharma, and thanks for asking that. But in this time, because of the stigma around COVID, a lot of people chose to remain at home and again, not go to the hospital. So we saw almost a 80 to 90% drop in OPDs, or the outpatient footfalls in hospitals, in private hospitals, and even in government hospitals for that matter. So if you think about it, during the first 2 or 3 lockdowns, people didn't end up going to the hospital. So obviously, for admissions in a hospital, they depend on the outpatient flow as well, because a lot of the outpatient consults will eventually result into an inpatient admission. So today, if we look at it, the the financial situation of our hospitals is definitely burdened. The cash flows are under pressure, and I've heard in industry bodies that they're close to, some hospitals are even close to just going bankrupt because they're running out of cash very quickly. And if you think about it, a hospital um has a lot of cost. The cost structures are very, very heavy, and it requires people to really work on thin margins. So while many people and the cynics will think that private hospitals are money-making machines, I just want to let you know that there's a lot of overhead costs and there's a lot of operational costs which make it very difficult for a hospital to even make a thin margin, and that's what is happening now. Now there is with as time has passed, we have seen more and more footfalls happening in the OPDs, and people are a little bit more willing to go for elective procedures within the hospital. So that has helped. But I think if we look at a country like United States and if we look at Europe, a lot has been done by the government in terms of funding the healthcare by doing some emergency funding. And unfortunately, in India, we have not seen that happen. So the backbone of Indian healthcare is the private sector. If you think about it, 4% of GDP gets spent on healthcare in India. 3% of it comes from the private sector, or private health sector contributes that 3%, and that's something which is getting compromised right now. And the government could step in and boost this spending on health services and making sure that private hospitals are able to deliver care. And also in the government hospitals, I think it has to take a holistic approach and really help both the private and the government sectors. The other part, which is a little bit been difficult, is that in certain cases, state governments have put a rate card on private sector hospitals to provide care for COVID and other ailments as well. So they have not consulted the private sector and really put a rate card which is at a fraction of what the cost of delivering care in these settings is. So obviously, if you're accessing high quality care, there's a cost to it. And unfortunately, I believe that the healthcare sector has been a soft target in that, because as health is a social subject and it is essential for human life. So is food, right? For example, and I want to ask, like, if we look at the food industry during the pandemic, obviously that was also important for sustaining human life. But were there any cost caps or capping in terms of pricing going on in the food industry? Did Parle Ji have to put the price of biscuits at 2 rupees for their 10 rupee biscuit? Because that's exactly what happened in healthcare in the private sector. So that's the conundrum that we face right now.
Yes, you certainly have a point there, Sumit, and I'm sure this point is being heard in the right places. Or there is another related question to COVID, and that's about some challenges that we have all faced in terms of diagnosis, testing, paucity of skilled workforce, infrastructure, among many other things. What are the innovative solutions that are on the horizon in India now that we can look forward to?
So, Brigadier Sharma, I think, again, you're absolutely right. This was a wake-up call. But what is amazing about India is that it always rises to the challenge. So whatever problems are thrown to us, we somehow figure it out. And I think, that's happened in many industries. And I love the example of here, the telecom industry, which has actually today connected so many Indians and done a grassroots level change in India. But more, when I look at what should be there when it comes to paucity of labs and diagnostic equipment and other things, again, resources were mobilized very quickly. So as I said, from one lab to more than 70 labs today are able to do the tests. Again, factories are producing PPE. We were able to very quickly look at innovative ways of manufacturing ventilators and even providing for them from various parts of the world. But I think if we were to look into the future, I think technology will play a very big role, because surveillance systems, disease surveillance systems, are going to become very, very important in the near future. So how do we leverage technology in a way where we are able to get to learn about spread of diseases which are happening? So at a community level, what are some of the interventions that we can make? And then at a city level or a town level, so can wearable devices create a cloud system or cloud gathering of data, which will allow for crunching in the back end and say that, you know what, Mumbai has had flash floods, for example, and we are seeing, people's blood pressure rising, and we really need to look into this and kind of intervene out here. So this is just an example, but there are so many things that can be done in terms of technology. And again, technology can be leveraged for skills, right? Because again, India has a shortfall, a huge shortfall of doctors. We today require 200,000 more doctors, 400,000 more nurses, and 800,000 more paramedic staff. But how do you ration them? Uh, the only solution, because we are only able to produce 50,000 doctors a year, which are joining the workforce in India, the only way to do bring effective outcomes and care is to use technology through which doctor-patient can interact, and that is something which will allow uh, the care to be delivered without having doctors all over in the remotest parts of India, which is very difficult. So I think again, technology has to play a role in this in a big way.
Or there is a related question. Thank you so much for that answer, Sumit. As we continue to confront the COVID crisis, healthcare providers are being forced to rethink facility design and how care is delivered. How does a healthcare provider harmonize the space, technology, and workflow for better outcomes? And this is one area I think you are in a particularly good position to answer this question.
Yeah, thanks, Brigadier Sharma, for asking that. I think, again, with this crisis of COVID, we have realized that there is a way where we have to segregate some of the patients which are high risk in the COVID category and highly infectious, and continue the services of the hospital in a place where we are able to assure that there is no infection possible. So I think when we look at these spaces, it is essential to look at ways in which we have a step up procedure. So in COVID facilities, it is important that we look at isolation, obviously for those who are not that sick, and then step them up to requiring if they require ventilation or not, and there has to be a separate entry procedure and exit procedure for that. And a lot of hospitals have already done that in India, but we have to look at again bringing the cost down for certain pieces of furniture or of certain things which are there in the isolation facility, because those patients do not require that much medical, I would say, supervision. So we can look at ways in which we can have lower cost solutions for them, whether when it comes to furniture or other things. But when we look at the space which is required for ICU care, there are certain protocols that need to be followed. So obviously that will add to the cost. But there is also again something called the RTLS, which is the real-time location services, which is something which our company Midmark does in the United States. We don't have that solution here in India, but that allows to track personnel within the hospital space and see what is their compliance. So have they where have they moved within the hospital? Where have they washed their hands? How many times have the nurses washed their hands? How many times a doctor has spent time in a room or moved around in a facility? So this is something which helps in bringing better efficiency into the healthcare system, because there's a lot of wastage which goes on in healthcare. To be very honest, out of the $12 trillion spent globally, I think about $3 trillion is wasted, which can be prevented with better tracking systems and better billing systems, and that is something which we are making a difference in at Midmark by bringing in better space management. And I think that is something which will continue to bring the cost down. And I think we have to bring that into India and implement it.
Thank you, Sumit. Now, we'll come to a question which you have partially answered earlier on the issue of rate card. Now, price control is a reality in India. There's no doubt on that. Does this really signal the end of private investment and innovation in India? Let's have your answer to that.
Yeah, good question, Brigadier Sharma. I think what does private sector in any country thrive on? A private sector will always thrive on returns, right? Return on investment. And if you look at the hurdle rate in India and the kind of interest rates that are there, uh, it's around 8%. And if you're lucky, you're at 8%. Otherwise, business loans stand at about 11%. And if you add the weighted average cost of capital, which is WACC, it's much higher. And you know, for a private sector to be successful, you really need to pass that hurdle rate, right? And that's something which is in the north of 15%. So if you're not getting that kind of return or a return on invested capital of over 10%, obviously private investments will go down. And the way today healthcare is structured in India, it's it's becoming more and more difficult to extract that kind of return because of increased cost pressures. And if we look at private equity investments, while there has been a lot of activity in this space in the healthcare arena for a while, I think they'll start rethinking because with the ROICs and the WACC numbers where they are, it's going to be very difficult. And if you look at innovation, the cost is always on innovation because uh, a lot of the returns are then redeployed into getting better equipment or spending on R&D, whether it be in a company like mine or whether it be in any other multinational, right? And if you're not going to get that return, you're not going to be able to allocate money into R&D and other innovation measures which are required because disease patterns are changing and we require more and more innovation. Um, Actually, the minimum spend on R&D in healthcare has to be around 3%, but it should be much higher than that. And that is getting compromised if we do not see a return, and they will retreat. Yes, the private sector will retreat, innovation will be stemmed, and already I'm seeing a lot of pressure from multinationals not able to get the price that they need out of India. So they are actually looking to exit from the Indian markets.
Thanks, Sumeet. As we were talking about price, we launched a poll with our audience here, and we are running a number of polls to get your perspective. In fact, one of the ideas proposed by Sumeet himself to get participation going. The question was: is the cost of healthcare in India unreasonably high? Do you think the price of healthcare in India is unreasonably high? We have our responses in. I'm just going to share that with our participants as well. We are talking about roughly about 66, say 70% of us saying they are unreasonably high. And from what I understood from what you've described so far, healthcare is standing up, meeting the COVID challenge. They're doing the best that they can, and we see that in the news. We see our colleagues, friends, sisters who are nurses, brothers who are in healthcare as well. They are driving to to work, coming back as the way after the sun sets down. So the people are up there performing. Yet the rest of the country, the patients themselves, have had numerous interactions with healthcare, and there is the sense that it is profit making. There is a sense that the margin is too high. There's a sense that the cost on the family wallet keeps going up unreasonably year after year. What would your response be for that kind of sense that some of us may have?
So, Nitin, this is interesting because I know that there's a lot of cacophony around healthcare costs, and then there is also a lot of mistrust which has been created between the healthcare system and the patient, the end patient, and that has led to also many times violence, right? And I think the Supreme Court just passed a rule now that if you're going to be violent to anyone in the healthcare system while they're delivering care, you can be put behind bars. I mean, I'm just talking about just the amount of mistrust that you end up losing your temper and you start taking things in your own hand. Patients have done that, but nonetheless, I think when we start thinking about healthcare costs, now again, I'll indulge you in some numbers out here. If we go back to early 2000, right, and if you look at the cost of a CABG or a open heart surgery of sorts, the cost would have been in the private healthcare system, say about 300,000 rupees or 3 lakh rupees, right, is what they would have quoted you at that time. And you'd be surprised that today also, if you were to get that quote from a private health system, it would be about 300,000 to 400,000 rupees, right? If you were to look at inflation from then and now, you know how how much inflation has been in India. If that 300,000 procedure should have been maybe costing more than ₹1 million, but actually it's only moved up maybe 20 to 25%, right? And otherwise it should have been maybe 300%. But what has led to that cost containment is the fact that there has been a lot of efficiency that has been brought into the healthcare system, right? We have been able to contain costs. We have been able to increase the number of procedures, which has again made it possible to pass those efficiencies to the patient. But the mistrust continues, right? And it's very sad to see that, because actually, if you were to go in and dig into the cost structures, you will realize that the price of healthcare delivery hasn't changed. Now, what has changed? I also want to acknowledge that the diagnostics have improved significantly, right, over the last 2 decades. So now your doctor will ask for more tests, right? And sometimes that's taken as a negative, because people say, hey, you know what, they're just prescribing more and more tests, and there's a cost to it because the technology has changed. I just had a back injury recently. I'm giving my own example. They asked me to do a lumbar spine MRI. I did that. I got some disc bulges which were there. But then my radiologist said that, you know what, I want you to also get a cervical spine MRI done, because I want to rule out something. I see something which I just want to rule out. Now there's a cost to that, right? And it's not cheap. An MRI is not cheap, and it's up to me now, right? Because the diagnostics have improved so much. The call is on me that you want to get a peace of mind. You want to get another test done, and just say that can I actually eliminate the cost on the healthcare system by knowing early on and preventing a disease which will take course later on, is something there. But I could look at it another way and say that am I being asked? I'm over prescribed on the diagnostics part, and it is costly. So then comes the mistrust. Or look at it in a positive way and say, the diagnostics has improved, and this could help me in the long run. So that's the kind of debate that has to be there. But overall, I can assure you that from a cost structure perspective, hospitals have looked at it in bringing about efficiency and have tried to pass it on to the patients. Yes, the other cost structure which is changing is the skills, right? So doctors and nurses and what we pay them obviously is increasing. The payments are increasing, but that's also required because we are just keeping them, at par with inflation, and that is necessary in any job that you do. So that's my take. I don't know if I fully answered the question.
I know you gave a perspective, and I think there is a perspective around inefficiencies or just R&D and improvement that we're talking about. And I'd like to continue the conversation. We've talked about COVID. We've talked about the perception of healthcare today. I just wanted to shift the conversation a little bit and start thinking about the future. So if you can help us peer into the future, the structure of healthcare today in India, as I understand it, is that it's largely services driven. We have 132 billion in services. We have pharma sitting at 55 billion, devices sitting at 11 billion, diagnostics a smaller proportion, 3 to 4 billion, even though they've been in the news recently. And then we have the primary healthcare sitting at about 13 billion. So if for our participants, I lay the structure out, where are you going? You're going to the hospital. That's the largest part. You're getting diagnostics done. That's a small, minuscule part. And then you are, buying medicines to help with your cure. That's a reasonable, probably half the size of the healthcare industry. What do you see as the change in the structure over the next 5 to 10 years? Or what do you see as the overall trends that are the tailwinds that are going to drive the healthcare sector one way or the other?
So I think the government has realized that health is important, right? For having a productive nation, a healthy nation is important, and that is something which they're working on. And they have recently committed that they are going to increase the spend on health from 1% of GDP, which is the public expenditure of health, to 2.5%. And I think what you touched on, Nitin, is the crux of how a healthcare system can be successful, and that is primary healthcare, right? Primary healthcare in any successful health system has to be robust. If that is robust, it is not about healthcare; it is about health, actually. And our objective has to be to keep people out of the hospital. So we don't want people to end up in secondary or tertiary care. We want them to be sorted out at the primary care level. So something which the Delhi government did, for example, is the Mohalla clinics, which were started by Arvind Kejriwal. Very good way. The interventions are required, right, at that level, because your burden and the price of healthcare increases as soon as an admission in the hospital happens, right? And that's where we want to drive our attention towards, is that we don't want people ending up in the hospital. We want to keep them out. But how do we do that? Now, I was very fortunate to have my early experiences at Kaiser Permanente, which is one of the large US healthcare systems. And they run their hospital system on something called population health management, right? Which is, in public health, it's studied widely. Population health management is to see that how do we create interventions to a large set of a population to keep them out of the healthcare system, right? And Kaiser has done that beautifully, because they had, I think, about 40 hospitals and 10 million members. 10 million members or people who are now. How Kaiser is in a unique situation that they have both the insurance and they have the hospitals. So it is in their best interest to keep the insurance and hospital admissions balanced, obviously, because there's a cost to keeping anyone in the hospital, and it is paid by their own insurance, which they offer to the members. So, but 10 million members are managed through 40 hospitals. How beautiful is that, right? So can we leverage something like that? But how have they done that? They have done that through technology. They have looked at, they encourage all their members to have primary health care checks on a yearly basis, and they are able to just pick up the segments which are the highest risk. So any given population will have about 10% of the population which is at high risk because of maybe smoking, because of just their lifestyle, because of previous history of theirs. So how do I actually come and counsel them and keep them out of the hospital and educate them and create awareness? I think those are the things that Kaiser has done a fantastic job in focusing on. And I think that is something which India is just starting on through something like the Mohalla clinics, and the primary healthcare has to become robust. Now, the other thing which I have a suggestion is that in India, our health insurance, which is offered, never covers primary healthcare. Right? It only covers secondary and tertiary healthcare. So when you're in the hospital is only when your insurance gets activated. So there is a disconnect. There's a big disconnect from primary healthcare, and that is why because there is no incentive for the insurer to keep you out of the hospital here, right? When that incentive is built, or if they are taking charge of primary healthcare, where they have to reimburse for primary healthcare, they themselves will become very intelligent to keep people out of the secondary and tertiary system. And that's something which I think India needs to change, about how healthcare insurance is provided by the private sector and even by say, schemes like Ayushman Bharat, which the government has just started, because they also only cover secondary and tertiary healthcare. Why aren't they playing an important role in primary healthcare? I fail to understand.
I'm with you. So you see a huge disconnect with the size of primary healthcare. We have some statistics that we've gathered as part of this exercise where we look at India as two Indias, right? There's 37% of rural population. Only 37% of rural population have access to any health facilities. Only 2% of doctors in rural India. So that's 700 million of our fellow citizens. And that's one doctor in every 40,000 people. So the primary, I wouldn't say primary healthcare system is broken. I think it's non-existent in a lot of India. So is that one trend you see or a necessity you see picking up?
It is definitely a necessity and needs to be addressed at war footing. We cannot afford to not have primary healthcare at the grassroots level or the last mile level, because this is really going to change how India will be in the next decade, right? India is a young, we always say that India is a young nation. We have the largest number of youngsters here, but think about it, in 10 years they're also going to get older, diseases will change, and there's a huge onslaught of new things which are coming in from a disease standpoint. But the calling is now. We really need to step up, and we need to focus on spending more on healthcare and health, I should say, not even healthcare. I should reframe, the word is health. And we need to look at ways in which we can bring about change and also contain cost, right? I think that's something which has to go hand in hand for a country like India. But right now, it's a minuscule spend. 1% is not adequate at all. And I think, just to give you another statistic on preventive healthcare, which is primarily driven from the outpatient or from the primary healthcare standpoint. On preventive healthcare is an outcome of primary healthcare checks, right? Only 9.8% is spent annually on preventive healthcare. So, and if you look, the more successful health systems will spend about 25 to 30% of their resources on primary healthcare and on preventive healthcare, right? And that's something where India is lacking again, big time.
Great. So the other trend or necessity you're pointing out is health, which is so far the structure is healthcare dependent. Once I'm sick, how do I get well? But how do I avoid getting sick? And for that, the approach you're recommending is a community approach. Did I get that right?
That's absolutely right. Community is essential, and then from a community standpoint, it and then goes to a town, city level, and then maybe at a district level. But the first level of intervention and accountability lies in a community, right? I mean, look at like what let me say that, what COVID has done. This is just amazing, right? Now, in my building, for example, where I live here in Mumbai, it's a community which decision, right? How many people can visit you? How many people will we let in to our building? Should there be a paper delivered? Should there be, milk delivery happen, or certain things like there are? So the community has taken accountability of healthcare, right? Look at how powerful that is, because everyone is now following those norms, and the community level, um, you know, policy making has helped everyone get better outcomes in terms of not having the infection spread, right? So this is what I'm talking about. This is where it happens. The change happens and the behavior change happens at that level. We have to drive all the way to that community. And a classic example is what Dharavi did, right? I mean, some amazing recognition has come from the WHO on how we have contained the spread, because the awareness was increased, the testing was increased. So it's if you look at Dharavi from a Mumbai standpoint, it would be wrong, because that's a micro set of Mumbai, and it has its own challenges, its own problems, its own density. So we need to tackle it at that community level, not at a Mumbai level, right? And Mumbai cannot be tackled at a Maharashtra level. So that's why community is so important.
I think you're hitting on an innovation platform here, which is how do we take the lessons from COVID and transfer that to those bigger issues of health, and how do we as a community become responsive to each other? I don't know if it'll reach a level when every time I order pizza, someone in my neighborhood is going to call me and say, "Hey, don't have that much cheese." But I think there is an idea here, and there is a lot that we can do to stop accepting cardiac issues, cancer as the new normal, and just challenge that as a community. So thanks for laying that out for us. Over to you, Brigadier Sharma.
We are coming closer to the end of our discussion, so I'm going to combine 2-3 important issues, Sumeet, which we want your comments on. We touched on the topic of insurance, and we touched on the topic of primary healthcare. Now, I want you to, I'm going to combine a question of Ayushman Bharat, which for the benefit of viewers, I'll just say that it's a national health protection scheme. It will cover about 10 crore poor families. Each family gets a cover of 5 lakh rupees per year in secondary and tertiary care. Now, so on one side, we have the government stepping in with insurance cover, which will of course increase. And in this case, the private sector hospitals can also be approached by a patient. It doesn't have to go to a government sector hospital only. And the other aspect is the low penetration of insurance, which is only hospitalization cover and no OPD cover. Now, what do you think is going to be the impact of the Ayushman Bharat scheme? How do you think the universal insurance health cover will it ever come into India? Maybe have your thoughts on that.
Thank you, Brigadier Sharma. So I'll just start with allocation to healthcare. Public allocation to the healthcare in India. So the health ministry has an allocation of 64,000 crores. 64,000 crores, and 1/10 of that, which is 6,400 crores, is spent on Ayushman Bharat. That's the funding Ayushman Bharat has during this financial year. Now, if you look at that, and you said 10 crores families, which is great, and if I multiply, just saying that it is five individuals in that family on an average, that comes out to be about 500 million people or 50 crore people. And if you look at 50 crore people, and I say that they get sick, 5% of the population requires hospitalization of this 500 million. The math around it comes out to about 2,500 rupees per person is what the allocation for just the sick is for Ayushman Bharat. 2,500 rupees, right? And 2,500 rupees today is the cost of maybe in a year two times a family of 5 can dine at Pizza Hut or something on those lines, is what I'm trying to get there. But how is a hospital in the private sector, even a government hospital, able to provide care for 2,500 rupees? And I'm only taking 5% of the people fall sick out of the 50 crore or 500 million people. So this is where I see that there is a big gap in the funding again. Right now, defense is important. It's great. We are spending on defense about 2% of our GDP, which is again all public health expenditure. Recently, we have bought Rafale jets at 59,000 crores, which is equivalent. 36 Rafale jets were 59,000 crores. The allocation to the health ministry is 64,000 crores. So you can think, yes, we have to protect our borders. We have to also protect our citizens, right? I just want to bring a comparison out there. But Ayushman Bharat is a good step. I'm saying it's something. It's in its second year or about 2.5 years. I think it's the right step. I feel that the way we need to take it is bring some onus. Why do insurance companies have a copay? We cannot dole out free stuff. We should also make everyone accountable. Whether we take 2% or 3% of the hospital bill, we need to we need to bring that accountability in Ayushman Bharat, where people are also held accountable for their own health, and they are responsible to pay, one, a certain amount of the bill. Second, Ayushman Bharat should cover primary healthcare, is my take, because without primary healthcare, we know that it brings more people into the healthcare system in the secondary and tertiary levels. And I think a universal healthcare path is being charted out for sure. The government has announced the National Health Digital Mission, which was just announced by the Prime Minister. Again, very minuscule allocation of 400 crores has been made for that. I think to digitize health records for every citizen in the country, a much higher allocation is required. But I think the will is there by the government. They have just embarked on this. It's been only 2.5 years, but I see this is the forward path. We just need to increase the funding. We need, the willingness is there. The other part which I want to also bring about is that skilling is very important. We are lacking. We can create as much infrastructure as we want. We can put as much money as we want into healthcare. But without having people, which are the doctors, the nurses, and the paramedic staff, we are not going to achieve anything. And today, we have brain drain out of India for people going abroad because they get better opportunities, because possibly they're not getting paid enough, or they seek better opportunities over there. A critical shortage of manpower. 200,000 doctors, 400,000 nurses, 800,000 paramedics are required as of today. And we have built capacity in the medical education front by 50,000 graduates coming out every year from the medical arena or MBBS degree, but that still is not going to cut it for us. So these are some of the things which I think we need to work on.
Thank you very much, Sumeet, for that answer. From my side, of course, we thank you very much for having come to our leadership studio and shared your thoughts with us. And we are very sure that we are in safe hands in the hands of Indian healthcare sector. Our future is bright, and I'm sure in the years to come, both with the public and private partnership, the healthcare sector in India will have a great future. Already, it is one of the bright sector of our country. Over to you, Dr. Nitin.
Yeah, I'm gonna echo that. Thanks, Sumeet, as well as your Nat Health colleagues, those participants that are part of the healthcare sector that are standing in the front line and literally helping us survive. There's another war going on at the border, and I would argue an even bigger war going on in our communities and our society right now because of this issue. Can I just, at this moment, invite any questions that we may have from our participants as well? So I'll keep an eye on that. And one of the questions is from our participants who has been in the healthcare industry. What's your sense about the alternative treatments, whether it's Ayurvedic hospitals, naturopathy? Are these going to take off and contribute to health in the country? What do you think, Sumeet?
I think, Nitin, that these treatments are definitely something which one cannot look at. I mean, allopathy cannot be looked in isolation, because naturopathy and other alternative therapies are essential. And many countries, actually, many people come to India seeking that, right? Ayurveda is very popular for people traveling. So medical tourism, if you see, is there. A lot of people seeking care into India because, one, it is cheap, but also the fact that there is a holistic approach to healthcare here in India. So they look at many alternative therapies like Ayurveda. Anything which is in the ambit of Ayush is looked at. And I myself today, to be very honest, after my back issue, I have taken a naturopathy route of things where I'm not actually taking any medication, but I'm letting myself heal naturally, and it's working wonders. Many times allopathy is a quick fix, but if you have the time and the ability to wait it out. Sometimes naturopathy works, and some of these alternative treatments have just proven wonders. So, and in India, you can tell that many of the companies which are doing work in this space have done well, whether it be Patanjali or Dabur or others which are trying to foray into this space. So the belief systems of Indians lies in these therapies, and it has proven to be good. And I see a lot of private equity activity in that, so I'm sure there are some good prospects coming along.
I'm with you. Thanks, Shashank, for that question. There's another topical question, and I think I'm going to link that from Rohit. How do we ensure safety and support of healthcare workers? And I'm going to add a question of my own. You, as a leader of cutting-edge healthcare service provider for the healthcare industry, how are you ensuring safety in your frontline?
So for us, safety, and for any institution, whether it be in the healthcare industry or otherwise any industry, this is very important. And I think what we did early on is build awareness and also a response mechanism which allowed for us to see that what is. So when I say surveillance, we did our own little surveillance system where we are checking our workers as and when they enter our premises, and we are trying to look at technologies which will help to do a mass screening, because right now obviously it's time consuming, and that takes certain things. And we are looking at ways in which we can constantly sanitize our factories and our office spaces so that we can keep the safety of the people intact. Obviously PPE plays a big role, but I think we have also asked that people voluntarily tell us that there is something which they're not feeling well, or they have come in contact with someone. And one thing is not to make them feel like there is anything that will be they will be penalized, because people feel like or there's that stigma around it. We need to remove that, and that's the approach that we have taken. So if you're supportive, we give them more time off. We say they want to come back. Actually, in our factory, the cases have been where people have fallen sick, and they say that we want to come back to work, and we say, you know what, you just take your time, just be at home, isolate yourself if need be, take the medicines or vitamins and minerals and whatever. But we give them time off. We do not hold them accountable during that time to come to work or even inform us. So those are things which have worked out well, I think, because everyone requires that emotive support. And I think that's, if you're able to provide that, I think that's half the battle won, right? I mean, that was what has helped us in a big way. And we do not say that you need to take time off from your accumulated leaves and whatnot. And there's a lot of counseling that happens. So that's something which has worked out well. And I think that's the future for any company to be or anywhere for it to be successful, is that emotive intelligence. I think that EI will play a big role in this.
I'm with you. As a student of organization culture change, we are seeing that as well. The trust that is being built up in some companies, and you're a great example of that. That can transform company cultures beyond this pandemic and actually result in a better workplace. So thanks for that. There are two very interesting questions coming in. I'm just going to request you for another 2 minutes, Sumeet. I know
Sure.
we are out of time. Sarfaraz asks, so what are the suggestions for young entrepreneurs that wish to enter healthcare? So if there are 1 or 2 or 3 areas where I'm a young person, I have limited resources, but I have boundless energy, enthusiasm, and a will to contribute back to my society, what should be those platforms that a young entrepreneur should think about?
So for that, I think I always think about value-based healthcare, right? So value-based healthcare, defined beautifully by a Harvard professor, Michael Porter, is outcomes plus quality divided by cost, right? So my suggestion to any entrepreneur, young entrepreneur, students, is to really look at this equation, take it to heart. Outcomes plus quality divided by cost. Now, this can be not only in healthcare, you can take it to any industry. So our objective as an entrepreneur should be to continue to bring the cost down, because it is inversely proportional, which will boost value. So value is inversely proportional to cost, and it is directly proportional to quality and outcomes. So if you keep on looking at ways in which I can bring out better quality of care or better access to care, and continuously bring out better outcomes when delivering care, or doing anything which is related to the healthcare supply chain, for that matter, or the care supply chain, uh, or the care continuum, I should say. That will be so. Whether it be net meds, for example, which was just, I think, Reliance is going to acquire, because it provides better access. It brings more convenience, right? And if it is really about outcomes, if we are thinking of quality, let's say that in both cases, quality and outcomes, if you look at AI's role in radiology, for example, analyzing radiology images, it does a better job. It's proven to do a better job than many radiologists, right? Because there could be fatigue and whatnot, but there's a 99% accuracy in analyzing radiology images by artificial intelligence. The computer can do that. And similarly, Watson initiative by IBM. So these are some of the things which are happening, which is really reducing costs and boosting that healthcare value equation. And I would urge every entrepreneur to look at it and see where they can contribute on this.
A great model there. So, Sumeet, that leads me to just summarize. We talked about how the Indian healthcare industry is standing up to the challenge. You spoke about what's going well. You spoke about what are the trends in the future, and you listed out your urgent needs for the healthcare market, which need to be done at war footing, especially the resurgence or the rise back of the GP, the friendly neighborhood GP that sees you first. That's what you're emphasizing. You're talking about alternative therapies being seeing the future as well for us. And your message for entrepreneurs is think hard about outcome, think hard about quality, and think hard about lower costs if you want to contribute in this sector. Great. Any final thoughts that you'd like to leave our participants with, Sumeet?
I think the only final thought that I want to leave everyone with is that let's take onus of our own health. I think if we are able to do that, there's a lot that we can put or blame or put our finger towards and say, the government didn't do this, the private sector is not doing that, or whatever. But it all starts with us. So and we can also blame the community for that matter, because it's it's easy to blame. But are we ourselves putting onus on our own health is something which should realize, and this is something which can be a big change and can really unburden the healthcare system, and this can be done through awareness, which can come to yourself about the things that you can do to your own health, and hold others accountable for that matter. I think that is something which is necessary, right? That community intervention, which you were just discussing, is something which we can think about. There'll be always temptations, right? We have temptation from the food industry, we have temptation from the gaming industry, we have to sit around from Netflix to be in front of our and be couch potatoes. But I think it all starts with us, and it all starts with taking that onus and holding ourselves accountable and our near and dear accountable for health.
What a note to end. So wear the mask to protect others, take care of your own health to protect society. So with that note, thank you, Sumeet, for your insights. Again, thank you for being in the front line as we fight against this pandemic. Thank you also to your team that supported us in pulling this talk together. So and also thank you, Brigadier Sharma, for joining in with me on this panel. This is Nitin. This has been part of Amity Institute of Training and Development's session on healthcare. It leaves me to say that I think Dil Mange More, Sumeet. So we should have you back for continued conversation on the topics that we couldn't cover.
I really appreciate the opportunity, Nitin and Brigadier Sharma, and all the organizing committee at Amity, because I think very timely conversation. I think this is something which can really, if I could have influenced a few hundred people to be more accountable for their own health and think of healthcare as an investment, I think we have achieved the objective today.
Thank you. Thank you for all our participants for joining in and being with us.
Thank you so much. Appreciate it.